Hi, I'm J.K. Wall. I'm the healthcare reporter from the Indianapolis Business Journal. We just finished the IBJ Power Breakfast on healthcare, where we talked a whole lot about healthcare reform. And now I'm here with Dr. Craig Brater, Dean of the IU School of Medicine. And Dr. Brater, as we talked about healthcare reform, we talked about the big goal being to cover most or nearly all of the 46 million uninsured with health insurance. One issue that if most people get that health insurance, we might need a whole lot more doctors to serve them, provide them health services. How easy is that to do? We're already at a shortage of doctors. You're in the business of training doctors. How would we respond if we've got all of a sudden 40 million new people with insurance? How would we have enough doctors to treat them?
Yeah, that's a key question. The Association of American Medical Colleges, which is the club of all of the medical schools in the country, there are 130, has been asking medical schools to strongly consider increasing their class size for the last 3 to 4 years based on manpower analysis studies. We did a manpower analysis for the state of Indiana and projected a 30% physician shortage in 2020 if we keep going at the same rate in terms of the class size. So 3 years ago, we actually started increasing our class size by 30, with a trajectory to increase it by 30% in order to try to head off in this shortage of physicians. So we've already started taking action steps to make sure that we've got enough doctors to meet the health needs of the entire population of Indiana, and similar things are occurring across the whole country.
You got a bit of money from the state government to do that, but I know you headed out to starting it just on your own. Do you need some more funding to help you really get to that goal of closing that 30% gap?
We always do, so you could expect that answer. But I think it's important to point out that we're really well positioned in Indiana because of the system that was started in the early 70s, where we have 9 campuses. And that means that we can increase our class size without incurring a very large additional cost. So let me give you an example. We're going to increase our class size by 84 students. Now, that's the size of some medical schools. We can increase our class size that much at what we estimate to be a total cost of only $5 million a year. If you did that, if you tried to train 84 additional people by starting a new medical school, it'd probably cost at least $100 to $150 million to get one started, and then you've got the maintenance costs that you need to keep it going forward. So we're able to do this essentially on the margin, which means that we can do it in a very cost-effective fashion. The state was generous with us in these difficult economic times to give us $3 million towards the 5, so that can really get us along this trajectory that we need. And I'm confident that our legislators will see the value of this, and in the future they'll give us the additional funds that we need to take the expansion to the full amount that we need to, again, make sure we don't have this physician shortfall in 2020.
Yeah. Last thing I ask is that some of the doctors I've spoken to about healthcare reform have been a little bit concerned that they might see their own pay decline, particularly if we had a public plan involved. Particularly specialists are concerned about this. Given that fear, do you have any concerns that might impact the number of applicants that you can get, particularly as you're trying to increase the pool of applicants and increase the number of enrollees you have at the IU Med School?
Well, it's easy to see why people might be concerned, because we have a lot of conversation about decreasing utilization, and right now people are paid on the basis of how much they do. We're talking about needing to compensate primary care better. Well, what does that come from? Does that come out of the hide of a specialist?
Yeah.
So it's understandable that specialists are nervous. Right now, I don't know how we'll see it play out. I would say that even in these times of turmoil, we are seeing increasing numbers of students apply to medical school. The talent pool is extraordinary. And at the end of the day, they tell us that the reason they're applying to medical school is because they want to help people, that they're not driven by money. And if they really mean that, then we should be okay.
Well, Dr. Brater, it's been a pleasure talking with you.